So students, this will be your discussion on parathyroid system. Just again as an overview, we are talking about your endocrine system. And when I talk about endocrine system, a lot of organs are involved. And we collectively refer to these organs as your endocrine glands. No? So they are collectively referred to as endocrine glands. So part of the discussion is you have the thyroid, then you also have the parathyroid problems, and we even had the pituitary problems. So kadamo kita glands sa body naton and its function. Okay, we differentiate endocrine from exocrine in such a way that endocrine class would have an effect on other parts of the body. Okay, those hormones excreted by your endocrine system would have impact on the other parts of the body. Now at this point, we'll be talking about your parathyroid gland. Okay, class, review of anatomy and physiology. Your parathyroid gland, students, produces your parathormone and regulates the calcium and phosphorus balance. Now, class, as you can see, your PTH or your parathormone increases the serum calcium levels. Okay, one function of your parathormone is to increase your serum calcium levels. Now, class, I would want you to have an emphasis on the serum calcium. Okay, serum. When I talk about serum, it pertains to your bloodstream, to your plasma levels. Now, class, if parathormone can increase our serum calcium levels, from what part of our body is your parathormone getting this calcium? From what part of our body is your parathormone class getting your calcium levels? Sige na, I would expect your participation. Okay, very good, class. That will be your bones. Okay, that would be your bones. Okay, now, class, that's why oftentimes, no, you need to remember this, that the PTH class increases your calcium levels by withdrawing it from the bones. So you indicate there, by withdrawal from the bones. Now, going back to the anatomy of our bone, there are two major competitors there, no? You have your osteoblast and your osteoclast. You have your osteoblast and then your osteoclast. Class, between the two cells that I have mentioned, what is in charge of bone breakdown? What is in charge of bone breakdown? That would be your osteoclast. Okay, class, so your osteoclast is in charge of bone breakdown. Now, students, with that being said, what do you think is the effect of PTH on the action of the osteoclast? When your PTH levels, students, are increased, what happens to your osteoclastic activity? Does it also increase or will it decrease? When the PTH levels, class, are increased, what would happen to the osteoclastic activity? So students, your osteoclastic activity would also be increased. Osteoclastic activity would also be increased. In other words, class, mas bumibilis ang bone breakdown. Okay, bone breakdown, class, is faster. Now, with that being said, let's say, for example, it has been long that your PTH levels are increasing, continuously increase PTH levels. What particular bone problem will your patient experience? What particular bone problem will your patient experience? Very good again. Class, that would be your osteoporosis. Okay, osteoporosis, which is characterized by the decrease of your bone mineral density. Okay, which is characterized by an decrease, of your bone mineral density. That's why I would usually tell you guys that PTH is considered to be an enemy of your bone. Okay, we label them as friends and enemies, and PTH class is an enemy of your bone. Now, let's look at this simple diagram which demonstrates the negative feedback mechanism between your calcium and your PTH. Because if you would look at this, once your serum calcium in the bloodstream would decrease, once class the serum calcium in the bloodstream would decrease, PTH would be released. Okay, class PTH would be released. And the release class of calcium will be from the bones. Okay, class, the release of the calcium will be from the bones. And then after that, class, once your calcium levels would start to normalize, or once class it would increase, the amount of PTH secreted by the blood class or secreted by your parathyroid hormone would decrease. Okay, it would decrease. Now, class, this is a demonstration of your negative feedback mechanism. Okay, that's how your negative feedback mechanism works. Now, class, gahambal kita gali sang serum calcium, no? What's the normal levels, by the way, of your serum calcium? What's the normal levels of your serum calcium? 9 to 11, that's a quick response. How about others? How about others? Why na? Why not may nagasabat sa normal levels? Kung potassium gani daw, dasig kita sa potassium. Okay, 8.6 to 10.3 daw mga Google give nga response. Okay, class, oftentimes we're playing at 8.5 to 10.5. Okay, 8.5 to 10.5. The unit for that is milligram per DL. Okay, mambal kamuti, sir, sa textbook is 8.3, kis sir, 10.3. Don't worry, class, in the board examinations, hindi man na siya magwa nga 8.4, 8.35, usually it's very low, it's very high. Okay? Now, let's talk about hypersecretion of PTH. Earlier class, hambal naton PTH nagapa-increase ang serum calcium. So, hypersecretion students of PTH would lead to hypercalcemia. Okay? Hypercalcemia. Now, if there is hypercalcemia, what do you think happens to the phosphate levels? Would it increase or decrease? Would it increase or decrease? Nag-increase class ang calcium. What would happen to the phosphate? Okay, that would decrease. So dapat madumduman ninyo later on kung super excited ang aton parathyroid hormone, ang pwede matabo is increase ang calcium pero decrease si phosphate. The opposite goes class for your hyposecretion, of course. So where in class there is decrease of calcium and then there will be increase of phosphate. Okay, because take note class, the relationship of your calcium and phosphate is inversed. Okay, now let's talk about the etiology. What are the possible causes of your parathyroid problems? Hypoparathyroidism class could be because of thyroidectomy. Okay, due to removal of parathyroid tissues. Okay, it may be because of accidental removal of your parathyroid tissues. That's why common class in the NCLEX or even in the NLE, they would ask the question, a patient with hyperthyroidism, for example, okay, a patient class with hyperthyroidism underwent thyroidectomy. And then after the procedure, let's say for example, hours post-op, your patient had tetany and your patient had positive Vostek sign. What complication will you be looking at? So class, the best answer for that will be already your hypocalcemia secondary to your hypoparathyroidism. Okay, that's secondary already to your hypoparathyroidism. Well, there are a lot of causes pa sa hypoparathyroidism. Pwede na yung class nga because of radiation therapy to the thyroid. Okay, pwede na yung class na surgical removal. But the most common is after thyroidectomy. Okay, the most common is after thyroidectomy. So as mentioned, class serum calcium would be decreased. Since calcium is decreased, there is neuromuscular excitability. So class, you have your tetany. What are the two signs gani isang tetany? Something that starts with letter C and something that starts with letter T. Okay, very good. You have your Vostek and Trusu. Okay, you have your Vostek and then you have your Trusu sign. Between the two guys, what would indicate carpopedal spasm? What would indicate carpopedal spasm? Is it your Vostek sign or your Trusu sign? Okay, class, it will be your Trusu sign wherein you will have carpopedal spasm. Now, if Trusu sign class is for carpopedal spasm, what's Vostek sign? How do we describe Vostek sign? What are the signs and symptoms manifested by your patient in Vostek sign? Ooh, in moments like this, I sing out a song. Okay, class, facial muscle twitching. Okay, facial muscle twitching. You need to specify, class, that it's the facial muscle. Okay, so what do we do, class, in Vostek sign? You just stop it here, and then class, your patient would appear to have involuntary movements. Okay, involuntary movements. Okay, then you have class, ari malanggali siya, no? Carpopedal spasm, that's your Trusu sign. Then class, you have your cardiac dysrhythmias. Other than potassium, one particular electrolyte that would affect class the functioning of your heart will be your calcium. So that's why cardiac dysrhythmias. Then you have numbness and tingling. Then you have seizure. This is related already, class, to the neuro effect of your calcium, hypocalcemia. Then you have visual disturbances or photophobia. Then class, wheezing and dyspnea. And class, the wheezing and dyspnea is also brought about by the hyperexcitability. This is brought about by the excitability, which leads class to your spasm, So that's why if gulpi lang, for example, your patient post-thyroidectomy, after thyroidectomy, naghambal ang pasyente mo, nabudlayan ako maginhawa. Okay, tapos class gulpi lang siya the tendency class is that your patient is already having laryngospasm. Okay, that's considered an emergency. For that reason, class, after thyroidectomy, what should be on standby at the bedside to address the increased risk for laryngospasm? Ano dapat, class, standby natin sa bedside para in case maglaryngospasm ang pasyente ko, ready kita. Oxygen. Sige. Daw ka namin isang oxygen, sir, kaya airway problem siya. Pero class, panumduma, magsira ang larynx mo, laryngospasm. Anong pa ang oxygen? Okay? What else? What else do I need to be on standby at the bedside? Very good, class. That will be your trach set. Okay? Ay, nga may mga question mark tanan. Okay, class, that will be your tracheostomy set. Okay? Tracheostomy set. Kung tulukon yung class, wala. Ganit kita naghambal ng intubation set. Because if laryngospasm, class, would ensue, close na during upper airways ang aton nga pasyente. And the best way, class, for us to open the airway is through your access to the trachea. Okay, that's why you need to have your tracheostomy set on standby at the bedside. Okay, now for the blood pressure, hypotension is expected. And then, class, your patient may also manifest with anxiety, irritability, and depression. All related, class. Kung tanawon nyo, class, ang signs and symptoms sa hypoparathyroidism, you can just go back to hypocalcemia. Okay, go back your studies on hypocalcemia, on fluids and electrolytes. That would be the same signs and symptoms that your patient is experiencing. Urinary calcium is of course decreased because it's not going out of the body. Plus serum phosphorus, opposite, that would be increased. Your alkaline phosphatase may be normal for this one. The alkaline phosphatase class can be normal. Alkaline phosphatase is an indication of activity in what particular organ of the body. Class, what does it mean? No? Kung alkaline phosphatase result is altered, let's say for example, it's increased, what part of the body is hyperacting or doing a lot of job? What does it indicate? What part of the body is doing a lot of job? Alkaline phosphatase. Sige na, 5, 4, could be the liver. Okay, liver. Damo ganyan nag-liver. Damo ganyan nag-liver. Okay, liver class is in charge of processing your alkaline phosphatase to get it out of the body. But what particular organ do you think? Kidney, may gallbladder na tayong pumapasok. What else? Among the organs mentioned here, ano class ang posible nga related sa parathyroid hormone nga na-overwork? That's why class your alkaline phosphatase is released in the bloodstream. Small intestine, pancreas. Okay, sige, for 0.5 points, ihabol natin yan. Okay, class, bones. Very good. Okay, all those who answered bones, tagbigyan ng 2 points yan. Okay, class, the bones. Class, the increase of alkaline phosphatase is already indicating, students, that there is an increased activity of your osteoblast. Okay, there is an increased activity of your osteoblast. Karon class, tanawan na natin kung nga nag-amo sila. Okay, now nga nautod niya ako notes. Nakapoy na siya, guro. Now, class, what will be your plan for your patient or what will be your diagnosis for your patient? Kadamo, class, ang pwede nga nursing diagnosis for your patient. You can have your risk for injury related to seizure for this patient. Okay? Although that's a risk diagnosis, that's a major concern on the part of your patient. Then, class, you could also have risk for ineffective peripheral tissue perfusion. Or if your patient students is already having arrhythmias, you could even have decreased cardiac output. Okay, tapuson ko anay sulat, risk for ineffective tissue perfusion. Kung nag-arrhythmia na siya, class, you could have your decreased cardiac output. Okay, class, in the case of tetany, you could also have the risk for fall. Risk for fall. And then, class, you can even have ineffective airway clearance. Okay, ineffective airway clearance. Related, students, to the laryngospasm that your patient may experience. Okay, so damo sang pwede maging nursing diagnosis in hypocalcemia. Now, as nurses, what do we need to prepare? We need to have your seizure precautions. Now, guys, let's talk about seizure precautions. When I say seizure precautions, what do I need to have on standby at the bedside? Namila magambala, be seizure precautions. Di ano dayon, no? What do we do for seizure precautions? What are the things that we need to stand by on the bedside? Okay, side rails. Don't worry guys, hindi po nawawala ang side rails sa hospital unless hindi kayo sa hospital nagtatrabaho. What else guys? Ay padded pad rails. Padded side rails. That's a good capture. Okay. Okay na. Move on na kita sa side rails. Next. Very good. Benzodiazepines. Okay. You stand by your benzodiazepines. May nakita kong oxygen. Mas importante na. Tapos plus benzodiazepines. Okay. Benzodiazepines. Now, other than oxygen, magimbutang ko din nga space. So, kay may next class na device na maka-address ang airways ng pasyente that we need. Okay. Very good. Your suction machine. Okay, suction machine. Because guys, if your patient would be drooling with saliva, you need to have the suction machine on the bedside, or else your patient would have aspiration. Okay, your patient may suffer from aspiration. Okay, these are the 4 things that you need to prepare for seizure precaution. A common thing that perhaps you might be adding was your tongue depressor. Okay, tongue depressor. Now guys, is tongue depressor still recommended to be used in the hospital setting for seizure? Is it still recommended to be used for a seizure attack, tongue depressor? Okay, class, not anymore recommended. Ha? Pero class, kung if ever gid man, no? Class may ara gyapon nga nagpa-prepare abis ang tongue depressor nga doctors. Students, your tongue depressor or even class in the board exam, may time nga nagwa sa board exam. Yung wala na class ang iban nga best nga answer but to have the tongue depressor. So class, if ever, kilanlanon again ha, tongue depressor, kung current na nga guidelines ang sundon, no, don't have it at the bedside. But if you're given no other choice and then you're mandated to have the tongue depressor class, please remember that your tongue depressor is best to be used, ha? It's best to be used during, ano ganit tawag ta sang promonitory signs sang seizure, aura. Okay, it's best class to be used during episodes of aura. Okay, class, in other words, you need to use it before the seizure episode. Okay, use it class before the seizure episode. Oftentimes, students, kung nag-deal ka mo sa mga pasyente nga may epilepsy, they would know that they have an aura. Mambal lang iban, oops, daw ko to'y chan ko, daw lain matsyag ko. Manog atake ko, meg. Mambal na, di sila manog atake sila. Okay, class, you can have they usually bite the tongue depressor para hindi nila makagat ila dila during the seizure attack. Okay? But then class, it is not advisable to have your tongue depressor during the active seizure. Class, kung nakakita na kamo sang pasyente nga nag-active seizure, once class na-clench na nila ang ilang ang ngipon nila class, once na-clench na nila, hindi mo na iya ma-force wide open. You will just be injuring the patient. If not, students, kung masulod mo gid man ang tudlo mo, basta ikaw ma-injure kay kadto na nilang tudlo mo. Especially if they're having clonic and tonic attacks. Okay? So again, that's for the tongue depressor. Now, class, oxygen. Okay, kung arang oxygen, hopefully nadumduman nyo man na dapat mag-standby kita sa nasal cannula. Okay, suction machine, of course, for suctioning. Class, kung sa hospital ka mga setting, dapat kumpleto ha. Hindi lang class na suction machine, dapat class dara na din ang suction catheter. Okay, sorry, hindi siya magsulat sa kilid. Class, dapat dala na ang suction catheter. And then other than your suction catheter, you also need to have your sterile water for irrigation. Okay, sterile water for irrigation. And of course, class, your gloves. Ha? Kaya kung kakaroon ba si mga balka mo ay tudlo to sa amon, prepare suction machine. Kaya ano na karong suction machine kung kulang imo mga gamit. Okay? Then class, you have your benzodiazepines. Students, give me an example of benzodiazepine. Give me an example of a benzodiazepine. No, take diazepam. Okay, class, you would have your diazepam. Sorry, class, wala man relevance ang paglain-lain sa colors ng ballpen ko ha. Okay, class, you have your diazepam. Okay, class, your diazepam is a benzodiazepine and it's considered to be a short-acting benzodiazepine. Its purpose is to halt the active seizure, to halt class the active seizure, and hence class improving the blood flow going towards your brain. Okay, yeah, very good capture also on lorazepam. And then perhaps the other drug that you can think of is midazolam. Okay, the common ones class used in pediatric patients is diazepam and your midazolam. Okay, pero class kadamuan ginagamit diazepam gid because it's more of a short acting compared to others, ha? Compared class to midazolam and lorazepam. Class, why do we need a short acting? When I talk about diazepam students, are they neurostimulants or neurodepressants? When I talk about benzodiazepines, are they neurostimulants or neurodepressants? Okay, yeah, they are depressant. So guys, if I will be giving a long-acting neurodepressant to my patient, I would not be able to accurately monitor the neurovital signs of my patient. I would not be able to accurately monitor class the neurovital signs of my patient. For that reason, short-acting is the one that is preferred to be used to address the seizure. Okay, that's it for your seizure precautions. Now, what else? The next point there, wait lang. Ang akon copy, mga utod-utod, no? Kapigado, na gitsang pangabuhi ta class. Okay, next class, you have your tracheostomy set. We've talked about your tracheostomy set. So the purpose of that is to address your laryngospasm. Okay, the purpose of that is to address your laryngospasm. Then you've mentioned oxygen, suction, so they are all part of your tracheostomy set. Now, calcium gluconate. Plus calcium gluconate is considered to be a ham. Who could tell me what a ham is? Yes, it's a food. Pero class of pharmacology, what does a ham stand for? Very good. High alert medication. So guys, it's a high alert medication. Huh? Plus your calcium gluconate is a high alert medication. Pharmacology would tell us that as a high alert medication, a little error on the dose of the medication could lead to adverse effects on the part of the patient. So daw na-mention ko man nagligad ko nga lecture class, when you're giving your calcium gluconate, you need first class to check with your hospital policy if your hospital allows it. There are hospitals that would not allow nurses to have calcium gluconate administration. Other than that, students, you need to have cardiac monitor on standby. Okay, you need class to have cardiac monitor on standby. Ano, not on standby, I mean, basi abi nyo karon dira lang siya sa kilid, cardiac monitor attached to the patient. Okay? Class, for example, in my case, kung ako class maghatag sang calcium gluconate, I would look at the cardiac monitor and look at for sinus pause or sinus arrest. Okay, cardiac monitor attached to the patient, not attached by the patient. Okay, attached to the patient. So, sa purpose nila is to monitor for arrhythmias, which is very common. Students, isa lang na ka-syringe, for example, na 10 ml or 20 ml, ihatag mo nga calcium gluconate, depending on the dose prescribed by the physician, but do not administer it within 1 minute. Okay, it should be administered for a duration of 20 to 30 minutes. Or else, guys, your patient would have a problem leading to cardiac arrest. Okay, class, your patient would have a problem leading to cardiac arrest. Take note of that. Now, you also have high calcium. This is class for the diet. You need to have high calcium diet and then low phosphorus diet. And then you administer phosphate binders. Plus, the purpose of the phosphate binder is for the phosphorus to bind. No? Mabind siya class sa phosphorus. Kapag bind nila class na duha, it will be easily excreted. Okay, easily excreted through the GI. Through the GI. Okay, para class ma-poop ang excess nga phosphorus kanina that your patient is having. Okay, next you have, where are we? Administer calcium and vitamin D. Guys, what's the purpose gani? Why is class you're having vitamin D administration? Why do I need vitamin D when I am administering calcium to my patient? Okay, very good class. It leads to or helps to the absorption of your calcium. Okay, very good. It leads or helps to the absorption of your calcium. Amo na class ang primary purpose niya. Kag maliban dira class sa calcium absorption, ano pag yan? Maliban sa vitamin D, ano pang pwede ta ma-advise kay patient agud to nga dali ma-absorb ang calcium? Ano dapat obrahon niya? Yes, wag siyang maging vampira class, labas-labas din sa araw. So sunlight exposure. That's very important class for the bone formation of your patient. Okay? Kasi class, sayang lang ang calcium, no? Very sayang lang na class ang calcium kung ang pasyente mo wala man class ang vitamin D. Okay? Now class, where is vitamin D coming from? Where is vitamin D coming from? Sige nga. Sige, butanghan ko small intestine. Birth sa small intestine mo gid siya ginpahalin. Okay, where is it coming from? Sige na, where can I get vitamin D? Okay, very good. Food have food. Okay? Kaya ang common na class na kinasabat is halin ko ng vitamin D sa sunlight. Okay? Let's correct that notion na it's not coming from the sunlight. Fatty fish is actually a correct answer. Sardines class could also be a correct answer for that. Okay? Class, especially the bones of your sardines, it contains high levels of calcium. So let's correct the notion na class, your sunlight only activates. Take note, students, your sunlight only activates your vitamin D, but it is not the source of your vitamin D. Okay? Now, class, if your patient will be taking calcium plus digoxin, if your patient, for example, has congestive heart failure, and then your patient is having digoxin, once taken students with calcium, you watch out for digoxin toxicity. Okay, there will be a higher risk of digoxin toxicity. Take note of that. And then, class, you have your bisphosphonates. Okay, allow me to have a quick check if this is biphosphonates or bisphosphonates. Okay, bisphosphonates. Now, class, give me an example of a bisphosphonates. No, I retakan this space na sulatan kaya karbaw akan agin. Okay, class, give me an example of this drug classification, biphosphonates. Sige na, give me a criteria. Give me, class, an example of biphosphonates. Okay, okay, nagagawa ng mga example. Very good. Fosamax. What's the generic name of Fosamax? I have seen Fosamax among the example. Fosamax, I mean. Okay, alendronate. Very good. Lang guys, mangita kita sang space for new messages. Okay, there. Okay, class, one example of your bisphosphonates is your alendronate. Okay, alendronate. Okay, so you have your Fosamax as a common brand name. Class, for your bisphosphonates, they are the drug of choice for your osteoporosis. Okay, they are the drug of choice for your osteoporosis actually. What activity do you think that these medications promote? Does it promote osteoblastic activity or osteoclastic activity? What activity does it promote? Okay, class, it promotes the activity of your osteoblast. It increases, class, the activity of your osteoblast to promote students' bone formation, to increase the density, class, of your bones. Now, students, one of the major risk factor or no adverse effect of this medication is your esophageal necrosis. Okay, one of the risk factor, class, of this medication is esophageal necrosis. Especially, of course, if taken PO, kung IV, class, wala naman na yagaagi sa esophagus. So for the PO preparations of this medication, problema ta esophageal necrosis. How do we prevent that from occurring? How do we prevent that from occurring? Sige na, after take some pasyente sang medications, what do you think will be our education to our patient? Take with fluid or water, pasar, okay? Next, intervention. Eat food, okay, class, take with fluid or water. Damo gid actually, class, ng fluid kag water, fluid gid kag water ha. Damo niya, class, ng fluid kinahanglan niya. What else? What should be the position of my patient, class, after taking the medication? Guys, your patient should remain high Fowler, very good. Class, patient should remain upright for the next 30 minutes. For the next 30 minutes. Students, once madislodge ang bulong sa esophagus ng pasyente, esophageal necrosis is very likely to happen. So for that reason, your patient must remain at high Fowler's position after taking this medication. Okay? That's it, class, for your hypoparathyroidism. Pasensyahan nyo lang ang mga notes dira. Next, class, you have your hyperparathyroidism. Now, class, for your hyperparathyroidism, there are different reasons. No? So, class, you have your primary and then secondary. Class, for the primary, it is usually, class, common among women. Class, magambal kita nga primary, take note, the problem is in the organ itself. Okay, class, the problem is arising from the organ itself. So, in this case, class, parathyroid. So, class, Common siya sa mga kababaihan, 60 to 70. It's rare in children. Plus, when I talk about secondary hyperparathyroidism, it's more common class because of CKD. Magambala ko students na CKD, so chronic kidney disease. Because of chronic kidney disease class, there is phosphorus retention. Now, class, kung nag-retain si phosphorus, sino ang electrolyte ang apektado kung ara si phosphorus na damo-damo? Calcium. Okay? Meaning class, nagnubo si calcium. Kay nagnubo si calcium, students, ano ubrahon ni parathyroid? Kay close to you sila yung class nga duwa, parathyroid would increase or decrease. Kay nagnubo class si calcium, mabawi gid class si parathyroid. Kay hindi siya magpasugot nga nubo lang si calcium. Okay, so for that reason, class, there is hyperactivity of your parathyroid gland. That's why your patient is having hyperparathyroidism. So what happens? Serum calcium class is increased. Serum calcium class is increased. Take note, ano ginbutang ko sa dalom, nag-decrease ya ang bone calcium. Nag-decrease ya class ang bone calcium kay hambal tagani kang gina, your serum calcium is being pulled out from that of your bone's calcium. Okay? Now, fatigue and muscle weakness would happen. Okay? Skeletal pain class and tenderness would happen. Bone deformity, students, would occur. Plus, ang bone deformity na, it's because of the imbalance of your osteoclastic activity and osteoblastic activity. Initially, guys, pag increase ang inyong osteoclast, your osteoblast would try to bawi, no? Mambal si osteoblast nga, ay osteoclast hindi na pwedeng ikaw na yung gapangimbabaw. So class, your osteoblast would also try to make bawi. And for that reason, students, this is the reason actually why your alkaline phosphatase levels would start to increase. Okay, this is the start class of the increase of your alkaline phosphatase levels. Okay, kay class, osteoblast will be doing the hard work. But since osteoclastic activity would be increased, no, because PTH is more potent, okay, so class, osteoclastic would still continue to increase. Now look at that, anorexia, nausea, vomiting, which are all class caused by your hypercalcemia, along with your weight loss, constipation, dysrhythmias. Okay, weight loss class, constipation, dysrhythmias, still class because of your increased calcium. Renal stones is because of increased calcium also. Polyuria is because class of the attempt of the kidney to excrete the excess calcium. The class, again, polyuria is because of the attempt of the kidney to excrete the calcium levels. Okay, and because of that, students, your patient may also be at more risk of dehydration. Okay, patient will be at risk for dehydration. By the way, class, matok anay ko sang concepts ng renal stone, nadumduman ko lang. So in this case, sa hyperparathyroidism, your patient class is at risk for renal stones because of the increased calcium levels. Plus, if your patient is taking calcium supplements, ma-increase man class ang risk nila for renal stones. Ma-increase man na ang risk nila for renal stones. Now, how do we prevent that increased risk for renal stones? How do we prevent, okay, that increased risk for renal stones? Okay, class, very good. Increase oral fluid intake. Kung ibalik ko dili class sa hyperparathyroidism, amo man agyapon. Ano naman yung mga IFO niya? Okay, kulang na lang mag-UFO na siya dito. Okay, class, so kung ibalik na siya class sa hyperparathyroidism, if you would want class to excrete the excess calcium in the bloodstream, also pull it out of the body by using hydration. Okay, hydration. Now, hypertension. Because what's one effect of calcium in our bloodstream or in our blood vessels? Does it cause vasoconstriction or vasodilation? Okay, very good. Plus one effect plus of your calcium in your blood vessel is vasoconstriction. Okay, vasoconstriction. Kung kaya't mahatag naman kita class ng antihypertensive. What do you think is the best class of antihypertensives that could address this problem? Hypertension due to increased levels of calcium. Anong nami nga antihypertensive na hatag din natin? Okay, ACE inhibitors. Okay, very good class. That will be your CCBs. Okay, you can have your calcium channel blockers. Okay, calcium channel blockers. Or ano nga drug ang ihatag ko para magguluwa atong mga excess ko nga calcium. What drug could I give so that the excess calcium would go out of the body? Nasa tamaan ka dali mag-type nag-diuretics now. Okay, class, so you have your diuretics. Very good. You give your diuretics. So kung makita nyo, class, ang mga lessons na nag-connect mo lang na sa previous nyo nga lessons. Okay, so you give your diuretics so that calcium will be out of the body. Okay, sige. Ano ning increased? Okay, urinary calcium would be increased. Again, ang bago kang ginap, kidney will attempt to pull it out of the body. So, or to have it out of the body, it will increase. Phosphorus, inverse relationship, it would decrease. And then plus alkaline phosphatase would be increased. As mentioned natin kang gina, by the way, class, wala ko ganun acknowledge kang gina. Tama man to class ang hambal, yung alkaline phosphatase is because of the increased work of the liver, increased work plus of the kidney. Okay? Amo na class nga ang alkaline phosphatase, hindi siya very conclusive na test, no? That's why you would need to do further testing for you to understand if what organ of the body is really affected. But in our case, kang gina, no? So it's because of the increased osteoblastic activity. Again, class, because the osteoblast is trying to make bawi because of the increased osteoclastic activity. Okay? Now, where are we? So on the management, no, sorry, gidan, kulang gurang budget, plus nautod ang akan nga notes, computerized na utod, ano, okay? The first on the list is, okay, you have your diuretics, so plus your furosemide is there on the list. Then the next one on the list is, kadamo, gitakan tinadula, gali. Okay, they have your normal saline solution, okay, your NSS for that matter. Now, class furosemide, what type of diuretic yan yung furosemide? Loop diuretic. Specifically, another classification in terms of potassium. Potassium wasting diuretic. Potassium wasting diuretic. Okay? Being a diuretic, what vital sign do I need to check before I give furosemide? Check the BP. And being a potassium wasting diuretic, obviously, class, you need to check the potassium levels of your electrolytes. Okay? Check the potassium levels of your electrolytes. Now, normal saline. Plus your normal saline, your normal saline class is your 0.09, now your 0.09 NSS, okay? Or your plain NSS, as we would usually say. Now, class, what is the purpose of this? Its purpose, class, is to have your hydration, class, to maintain hydration. Duhani, class, ang purpose is hypercalcemia. Una, class, is hydration. And then the second purpose is that your sodium class facilitates calcium excretion. It also facilitates calcium excretion. Okay. The principal class goes back to your cations and anions. If you can recall, class, your calcium and potassium are both positively charged ions. No? So the tendency is that one could not be with the other. So it facilitates also calcium excretion. Okay. The next class, you have your calcitonin. Okay? Kung kang gina, si PTH class is considered to be an enemy of your bone. Your calcitonin class, I call that calcitonin is a friend of my bone. Ha? Calcitonin students is a friend of my bone. Why? What does calcitonin do, class? Ano ginaobra niya? Does it increase osteoclastic activity or does it promote osteoblastic activity? This time, class, si calcitonin, miguhay na sila yan ni osteoblast. And plus, it makes calcium stay in the bone. It makes calcium stay in the bone. Amo naman niya, class, ang role ni calcitonin. Para, class, ang excess levels natin nga to, in fact, class, amuning namin nga management sa hyperparathyroidism. Because, class, kung sagad talang kapagwa ang calcium, no? For example, if we would just continuously use diuretics, guys, ang bone naton nagaka-deplete sang calcium levels. Kaya tapos, class, for example, nag-manage ka na diuretics, ano nga nag-ubos na to sinagwa, ang next thing naman nga obrahon mo, sige, refilter naman ang lawas ng calcium, kaya ang bone naton brittle na. Okay, that's why, class, calcitonin is a good treatment to be combined here with the others, just to ensure, class, that the bone would have sufficient calcium levels also. Okay, for the bone to have sufficient calcium levels. Now, class, you have your phosphates. Okay, phosphates, kaya nadubo natin na phosphorus dire. So you need to give your phosphates. Now, Parathyroidectomy is of course the surgery because your parathyroid is hyperactive. So there are tendencies class that you need to remove the parathyroidectomy. Below class this table, I think that ako ginbutang ang indications. Okay, this is class the criteria sa asymptomatic na patient to for surgery. But going back first, okay, parathyroidectomy. So class monitor RR. Tapos class, ara naman trach O2 suction. Nga class, after kuha sang parathyroid, ano naman ang risk? Hypoparathyroidism. Diba? After naging kuha ang parathyroid class, your patient will be at risk for hypoparathyroidism. And for that reason, you would need to have the precautions for hypoparathyroidism. Monitor class for bleeding, also monitor for hypocalcemic crisis, kaya basi magsururot. Then class, you would need calcium and vitamin D. Okay, you would need class to have calcium and vitamin D supplements for your patient. And then after that, guys, you need to give hydration therapy to your students, to your patients class, about 2 liters per day. About 2 liters per day. Wala naton guys gina-encourage ang thiazide diuretics. Okay? Class, for the management of your patients with parathyroidism, we do not class encourage thiazide diuretics. Nga class, wala naton siya gina-encourage. Your thiazide diuretics class decreases, it decreases renal excretion of calcium. In other words, class, lain siya hindi siya sa parathyroidectomy nato na, but for the parathyroid, hyperparathyroidism in general. So class, kung nag-increase ng calcium levels naton, dugangan pa sang thiazide diuretics class, your patient would have severe hypercalcemia. Okay, your patient class would have severe hypercalcemia. Now, ambulation. Ano class ang effects ng ambulation sa bone naton? What does ambulation, what does movement, what does exercise do to our bones? Sige nga, what does it do to our bones, class? What does exercise do to our bones? Very good, class. It would move your serum calcium to your bone. Okay, promote storage of calcium, that's very good. So class, when you ambulate, okay, kung daw bone man ni class ang drawing ko, pasensyahin nyo lang. So class, ano ginaobra class ang ambulation? Your calcium level students from the bloodstream will be going towards the bone. Okay, it increases class calcium absorption by the bone. Tama ka mo class, it promotes osteoblastic activity, it decreases osteoclastic activity. Okay, so class, ang overall effects ng ambulation, it would decrease your serum calcium. Because it decreases class your serum calcium, nag-decrease pa siya class sang renal calculi. Okay, or your kidney stones for that matter. Okay, so those are class the effects of your mobility. Later on, when you will be learning musculoskeletal, ma-realize nyo na kadamo gitpiyasang mabuligan class kung nagahulag ang pasyente nyo. That's why class, even in operations no post-op, ano ganyan yung education natin, move. No? If you're the patient, you need to move as early as possible. Okay, hindi sagad ka stay on bed if kaya mo maghulag because that will be helping to prevent complications. Now, class, the criteria for asymptomatic patients class for surgery are indicated there. Now, class, for your hypercalcemic crisis. So, hypercalcemic crisis, tanggi na to normal ta 8.5 to 10.5. Si hypercalcemic crisis, yung class, naga more than 13, no? Now, class, once your hypercalcemic crisis would occur, so class, may neurologic, cardiovascular, kidney symptoms would happen. Okay? Now, ang bantayan yung gida, of course, is your neurologic and cardiovascular na symptoms. So, ano ginaobra natin? It's also considered an emergency. Okay, it's also considered an emergency. So, class, ano obra ta? Rapid rehydration with large volumes of IV isotonic saline solutions kag calcitonin. Then, class, you have your, so, class, your calcitonin class would promote renal excretion of excess calcium and also would reduce bone resorption. However, class, if you're doing the rapid rehydration and then you've noticed that your patient is manifesting signs of fluid volume excess, maliban class sa edema kung before class wala abi, for example, pneumonia, pasyente nyo, tapos class, once you have done your fluid volume resuscitation or naga-fast drip kita sang fluid kagang pasyente ta guys nang develop crackles, that is an indication that our patient is having congestion. So what do we do, class? Stop naman kita plain NSS kag administer diuretics. Kay base karon malingaw lang kamo ni doc class kang rehydrate ka pasyente para magnubo ang calcium levels niya. As nurses, students, we need to monitor that our patient is not having fluid congestion. We need to monitor class for fluid volume excess and fluid congestion. Class, pay particular attention kamo sini, especially class if your patient has CKD and then your patient has CHF, congestive heart failure, and chronic kidney disease. Okay? That's why class makita nyo na kisa sa CKD nga patient, no? Kung class manog dialysis, nabi sila. For example, mahambal ka, doc, calcium sang pasyente naton 11.5. Mahambal na sa imo si doc, sige lang nurse, monitor lang the heart ni patient, pulaton talang magdialysis siya. Because class, the doctor needs to weigh between the benefit and the risk. Kung birahan niya class ka-rehydrate ang pasyente, considering that the patient is a CKD patient, the fluid class will be staying inside the patient's body. With the fluid staying inside the patient's body, you are facing another consequence class, fluid volume excess, congestion, which would lead to breathing problems and several complications also. Okay, so kisa mambala si sige nurse, monitor lang daton nga heart, bantayi aton cardiac rate, attach lang sa cardiac rhythm, kulaton ta lang kay dialysis yaman nga schedule boss. Or mahambalang doktor ti sige wala ta mahimo ipa-stop dialysis siya naton. Okay, because class your dialysis could also help, no? Your dialysis class could also help for your ano na ganit tawag to reduce the calcium levels. Okay, ara gani nakabutang sa aton nga notes, so nakabutang na nga your drugs or your management, I mean, will be your mithramycin, calcitonin, and then dialysis class for emergency situations. Okay, dialysis for emergency situations. Okay, that's it for your parathyroid problems. Okay, students, 5 minutes break. 5-minute break. Okay lang? Okay. For the purpose of this recording, you may take your break. Okay, so guys, your adrenal gland is our next topic. So class, let's review first your adrenal glands, the anatomy of your adrenal glands. So class, you have your adrenal medulla. Class, your adrenal medulla is the center of your adrenal gland. Wait, by the way, before that, where is your adrenal gland located? Where is your adrenal gland first located? No, board exam class questions could be as simple as that, no? And people are like, oh, where is it located? Okay, so above the kidney, ha? It's located above the kidney. Adrenal medulla, guys, it's the center, no? So class, the purpose of your adrenal medulla is to excrete your catecholamines. Now, class, when I talk about catecholamines, what particular system does it trigger? What specific component of your nervous system, class, is being triggered by your catecholamines? Catecholamines. Okay, class, catecholamines. No, kasi lasa akong mag-pronounce. Okay, class, it triggers your sympathetic nervous system. Okay, it triggers your sympathetic nervous system. Just as a quick review, when it triggers your sympathetic nervous system, what does it do to your heart rate? What does it do, class, to your heart rate? Okay, it increases your heart rate. Very good. What does it do, class, to your blood pressure? What does it do to your blood pressure? Okay, it also increases, students, your blood pressure. What does it do, class, to your GI movement? What does it do, class, to your GI movement? Okay, it slows down your GI movement. Okay, very good. It slows down your GI movement, leading towards constipation. What does it do to your pupil? Pupillary dilation or pupillary constriction? Pupillary dilation or constriction? Oh, wait, are you sure? Okay, let's pause for a moment. Okay, class, it would have pupillary dilation. Okay, what else? GU, genitourinary. Okay, it leads to retention. Kaya, list sa ulo niyo ang mga simpa at parasympathetic response niyo. Okay? Oh, by the way, we're talking about catecholamines. What are the prominent catecholamines that would trigger your sympa system? What are the prominent catecholamines that would trigger your sympa system? Very good on epinephrine and norepinephrine. Okay? Epinephrine and norepinephrine. Okay, let's proceed to our main focus for this afternoon. You have your adrenal cortex. So class, your adrenal cortex is the outer portion of your adrenal gland. It would secrete your steroid hormones, which is of course regulated by your hypothalamic pituitary adrenal axis. Now class, how does this axis works? No? So class, your hypothalamus would secrete your CRH. On return class, or in return, I mean, your CRH would stimulate your pituitary gland. And then class, your pituitary gland would secrete ACTH that stimulates class your adrenal gland. That stimulates your adrenal gland to release hormones. Okay? Now, there are 3 hormones there that you need to remember. You have your glucocorticoids, your mineralocorticoids, and then your sex hormones. I think I was able to touch some of this on the introductory lecture. Now, class, let's talk about your glucocorticoids. When I say students glucocorticoids, what does it do to the blood glucose levels? Anong ginagawa ng glucocorticoid class on the blood glucose levels? It would increase your blood glucose levels. Okay? That's why, class, if you will be remembering the 3 S's, the glucocorticoid students is associated with sugar. Okay, sugar. Next, class, aldosterone. Diba? I've differentiated to you aldosterone class and ADH. So aldosterone class would contain, or would affect what? What does it retain? Okay, mega salt, may naga water. Ano gid ba nang dapat? Okay, very good class, ha? Class, for you to get or differentiate aldosterone from ADH, you need to say that aldosterone is talking about sodium and water retention. Sodium and water retention. And on the 3 S's, students, this corresponds to your salt. Okay, this corresponds, class, to your salt. Then, class, your sex hormones, your androgens, that would be talking about your secondary sex characteristics, and even, class, your libido. So, class, secondary sex characteristics, libido, and then, class, for the 3 S's, of course, that would be sex. Okay, salt, sex, and sugar. Please remember that. That's the 3 functions of your adrenal cortex. Now, let's talk about your glucocorticoids. Class, your glucocorticoids, ari na naman class ang pinigado kung notes, no? Pasensya, ged. Now, class, for your glucocorticoids would have increased CBG. Okay, class, your glucocorticoids would lead to increased CBG. And then other than that, class, your corticosteroids, what does it do, class, to the inflammation? Di ba, class, ang aton nga steroids, we would classify them usually as anti-inflammatory drugs. Okay, so for that reason, class, it also decreases your inflammation. Okay, it's considered to be an anti-inflammatory drug. That's why, class, it's considered to be an steroids na. Then, class, too much. Kung masubrahan ikaw, class, kag glucocorticoid, anong pwede matabo sa imo? Diabetes mellitus is on the list. Kay balaan mo nagapa-increase sa class ng CBG. Or your blood glucose, I mean. Osteoporosis, class, because the long-term effect, class, of your steroids, tandaan nyo the long-term effect, class, of your steroids is that it also decreases bone mineral density. It also, class, decreases your bone mineral density. Now, students, your peptic ulcer disease. Your peptic ulcer disease is related to the decrease of the gastric protection. Class, it's related to the decrease of the gastric protectant lining. And then there will be an increase of protein breakdown and then redistribution of body fats. Okay? That's why, class, kung tulukon yung itsura sang somebody nga may excess students ng glucocorticoid hormones, makita nyo, class, ang itsura sang may Cushing syndrome. They are usually described to have moon face. They are usually described to have buffalo humps. Okay, moon face kag buffalo humps. Guys, ang moon face na kag buffalo humps are actually fluids and fats that are being redistributed in other parts of the body. Okay, that is an indication of increased already of your glucocorticoids. Okay, now, class, you have there an example of hydrocortisone and dexamethasone that would remind us students that these medications would have also the same effects, guys, as the increase of the glucocorticoids inside your body. Tanawan nyo bala, students, ang side effect gani, tapos book sa inyong drug handbook. Tanawan nyo, class, ang side effects sa mga bulong nga dexamethasone. Tanawan nyo, class, ang side effects ng bulong nga hydrocortisone. Kung tanawon nyo, students, mad-the-same na di sila sa side effect niya. Okay? Because, class, we call the 3 These three students are what we refer to as your intrinsic steroids. They are what you refer to as your intrinsic steroids. In other words, guys, class, they are inside your body. Iniya class ng mga bulong nga gina-take natin, obviously, they are your extrinsic steroids. Now, mineralocorticoids. Class, your mineralocorticoids will be taking charge of your electrolytes, particularly as we have mentioned ng paulit-ulit, aldosterone will be talking about sodium and water retention. Now, let's elaborate our knowledge. Since we have sodium and water retention, our patient students will be at risk for hypernatremia. Now, if there is hypernatremia, what part of the body do I need to watch out for? Ano naman nga parte sang lawas, kag functioning sang lawas ang bantayan ta? Edema is there. Okay, class, I've been waiting for brain. Okay, brain. Okay, class, the neural activity of the patient will be strongly affected because of the imbalance. Kag kung pamangkoton kamo kanong probable reason sina class, it could be of your cerebral edema. It could be also of your cerebral dehydration. Okay, take note of that because your sodium has a very big role on the osmolality. It has a very big role on the osmolality. Palawakin ta pagiglas ang panumduman ta. Once sodium is affected, the action gid ko di wala gali gagwa ako nito. Plus once your sodium is affected, what particular electrolyte? Ano pagid nga isa ka electrolyte problem ang panumdumon naton? What another electrolyte problem? K. What about the K? High or low? Okay, very good class. Your low potassium. Your patient will be at risk for low potassium. And it goes without saying, if I have a problem with potassium, what particular organ of the body do I need to watch out for again? This time, class, you need to monitor na naman for the presence of dysrhythmia because, class, your heart would be the next problem. Okay? So kung masubrahan ka naman, class, ng mineralocorticoid, amo naman ang problema mo. Next, class, you have your sex hormones. So it's release of androgens and then some of the estrogen, no? Plus even in male, take note, mga boys, may estrogen man kita, hindi porket lalaki, wala kasang estrogen. Now, when secreted class in excess amounts, it would result to what you refer to as androgenital syndrome. Okay. It would result class to what you refer to as your androgenital syndrome. So class, anong included sa androgenital syndrome natin, class? You would have your masculinization in women, feminization in men, and then premature sexual development. Okay, class, kumbaga, if you're looking at women, nadag ko ilaya muscles, may mga facial hair nga nag-appear. Kung sa babae naman niya, kung sa lalaki naman, class, there is gynecomastia. Okay, and then small size of the penis, for example. Then, class, you have premature sexual development. Okay, so try to remember, class, kag ibalik nyo sa salt, sex, and sugar, I can assure you that you can remember all those other things about these three hormones. Now, adrenal medulla. So function is on the autonomic nervous system. Specifically, guys, we're talking about your sympathetic nervous system. Specifically, you're talking about sympathetic nervous system. Now, class, the catecholamines involved are your epinephrine and norepinephrine. And then for epinephrine and norepinephrine, guys, so it results to the release of your fatty acids. Okay? And it is the fight or flight response naman that we're talking about. Kag pareho sang hambal ta kang gina, decreases blood flow to the GI, and then class, it also increases blood flow to your tissues, the cardiac and the skeletal. Okay? Sa simpanyo naman, class, ang common na niya ginapadumdum ko is fight or flight response. Pagkatapos, students, you always say that in simpa, it will be dry. Okay? Class, sa simpa, it will be dry. If you can connect all other changes there, class, you can memorize what's happening in simpa and parasimpa. Okay, where are we? Now, let's talk about exogenous steroids and adrenal functioning. Exogenous, meaning class exogenous, that will be outside of the body. Okay? Now, class, this diagram, I would want to differentiate. This I would want to elaborate kung ano class ang posibleng effect sa exogenous steroids. Okay, magambala ko class exogenous outside, di ba? So these are your pharmacologic agents. Now, give me class conditions. Name conditions that you have learned wherein you would need steroids for life. Or bisan steroids lang as a maintenance medication. Name a few. Okay, psoriasis is one. Pero unahon ko gitakan si asthma. Kay balaan mo bias na kan kay asthma. Okay, asthma, my favorite, no? I have asthma. O tinag-asthma na sila tanan. Next, kay psoriasis. Next, COPD. Sige, tanggapin si COPD. Paminsan-minsan steroids. Lupus, systemic lupus erythematosus. What else? What else? Arthritis. Oh, sige, arthritis. Pwede to decrease inflammation. Okay? Cancer. Sa cancer, wala siya masyado gina-maintenance, but yes, it could be used. Gout. Gout plus if gouty arthritis, usually uric acid medications. IBDs, inflammatory bowel diseases. What else? Okay, Crohn's. I've seen Crohn's. Okay, IBDs, arthritis, IBDs. Yeah, I see that. Meningitis, by the way, wala kita usually ga long-term na steroids. No? Steroids is just used to decrease inflammation. Allergies, okay, let's have allergic reactions or allergies. MS, I can see multiple sclerosis, good mention for that. Autoimmune diseases, it's a very safe capture. What else, class? Ano nga surgery nga obrahon sa isa ka pasyente nga once class maobra ko siya, I would need to have steroids for life? What particular surgery would need steroids for some time? Okay, ano class nga surgery? Okay, search, surgery, steroids, life. Wala may gagwa. Hindi pagsaligi si Google. Class, what surgery? Sige nga, what surgery? Hypophyseectomy, thyroidectomy. Oh, adrenalectomy, that's a safe one. Class, ano nga, let's say, hindi lang tabi manumdum sang endocrine. Ano class nga surgery for the body? Okay? Any body part, not just the endocrine. Where in class you would need steroids. A 5, a 4, a 3, spine surgery, brain surgery, adrenal gland surgery. Anong keyword ko nga dapat hambalon man? Yes, related siya sa kidney. Pwede siya kidney. Pwede man siya liver. Hindi siya pwede brain. But guys, wala taguro nag-angot. Very good. Transplant. +3 for that. Okay, class, organ transplant. So students, if your patient would undergo organ transplant, you would need to have steroids for life. Okay, just to prevent class what do you call that? The rejection. To prevent the rejection. So class, any of these medications, any of these conditions, I mean, would warrant the need for your steroids. Okay, would warrant the need for your steroids. Name an oral steroid first before we go on. Name an oral steroid. Hydrocort kasi kag dexamethasone is commonly class IV. Okay, at least kilala nyo si prednisone. No? Kilala nyo si prednisone. Now guys, look at this diagram. Once class, you have this condition, the tendency, either of these conditions, the tendency is that you will be managed by steroids. Once class you are managed by steroids, you would have class the adrenal cortex. Ano class ang kakatabo sa functioning ng adrenal cortex? Class nag-decrease ang pag-function ng adrenal cortex. You know why, class? The adrenal cortex would think, ay, may steroids naman sa lawas. Okay? Somebody is producing steroids for me, so I will not be working. Hambali adrenal cortex. And because of that, class, there will be adrenal cortex atrophy. There will be adrenal cortex atrophy. In other words, class, nagpigado ng function ni adrenal cortex. When we say atrophy, there is a decrease in the tissue mass. There is a decrease, class, in the tissue mass and even, class, the cell function. Nagamay siya. Kinagamay. And because of that, class, your patient will be at prone of adrenal insufficiency. Your patient students will be prone for adrenal insufficiency. Okay? Ang logic class in a class is, once your patient is taking steroids, your adrenal gland would be dependent on those steroids that your patient is taking. And negative feedback mechanism, it would stop. It would stop functioning. Now, if you would do it abruptly, let's say for example, ma'am, balkay, way na takwarta, untat na prednisone. Tomorrow morning class, your patient will undergo adrenal insufficiency. Signs and symptoms of, when I say adrenal insufficiency, would that be Addison's disease or Cushing's disease? Or Cushing syndrome, I mean. Okay, class, that would be signs and symptoms of your Addison's disease. Okay, leading towards class your Addison's disease. Now, let's talk about class abrupt withdrawal. Nakasulat na no, in case of abrupt withdrawal, there would be adrenal insufficiency. Class, ano ato nursing intervention? Butang taabi asthma. Nag-take ako class prednisone. Okay? What will be my nursing intervention to prevent adrenal insufficiency? Okay, good answer. Taper the dose. And when we say taper, class, gradually decrease the dose. Gradually decrease the dose. Okay? So class, ano ginaubrata sina? For example, ma-prescribe na class ang doktor. Mambala siya class prednisone. 20 milligrams TID. Ano ganing TID class? How many times a day na? Okay, 3 times a day. So class mambal sabi, prednisone, 20 milligrams TID for 3 days. Tapos class mambal siya, prednisone, 20 milligrams BID for 3 days. Tapos class mambal naman siya again, prednisone na 20 milligrams OD for 3 days. Okay? Class, dira mo class makita that the doctor is trying to taper the dose of the medication. Hindi class pwede nga mahambal siya, okay, ikaw nga asmahon, prednisone ka nga 20 milligrams TID for 5 days tapos stop. Hindi class, because that would increase your risk class for adrenal insufficiency. That would increase your risk for adrenal insufficiency. The same class sa clinical setting, no? Kung for example, admitted ang pasyente natin for asthma, usually class gahatag kita hydrocortisone. Ang common niya na students na dose, hydrocortisone 100 milligrams Q8 hours. Gahatag kita every 8 hours. Okay? Pag severe pagigaling ng asthma, gahatag kami sina every 6 hours. So class, hindi ka mag-expect na after 2 days mahambal si doc, okay, wala na siya wheezing. Controlled naman iya asthma. Hindi ka class mag-expect na mahambal siya DC hydrocortisone. No, you don't expect that to happen. Instead, students, what you would expect is that mahambal ang doctor ay mahambal na siya hydrocort kaanay nga 100 milligrams Q8 for 1 day. Pagkatapos plus pagkabuas i-Q12 yan na. Okay, that's what you meant plus nga dapat i-taper mo ang dosing. Okay, it is not abruptly stop. Instead, class, you should gradually stop it or else your patient will be at risk for adrenal insufficiency. Or else, class, your patient will be at risk for adrenal insufficiency. Okay, so class, why did we talk about that? Because that is a major risk factor going towards your Addison's disease. Okay, it's a major risk factor going towards your Addison's disease. Now, you have autoimmunity. You also have class idiopathic causes, the tumor, tuberculosis, fungal infection, and even hemorrhage. They could all lead class to Addison's disease. Sa hemorrhage kaniya class, secondary sinimatabo is that ma-decrease class ang oxygen pakadto sa inyong adrenal gland, ma-decrease iya functioning. Okay, that's for your Addison's disease. Now, class, nag-decrease ang sugar. Anong pwede matabo? No? Kita mo class, gibutangan ko the assessment for decrease of sugar. Class, ang CBG naton manubo. Pila gani normal ta nga CBG class? Pila ang normal ta nga CBG? Okay, 120 range. Give me a range. Okay, 60 to 120. Okay, class depending sa institution, no? Yeah, I'll accept 80 to 120 ha. I don't know lang kung nakahambal ko sa inyo before 70 to 120. That's also accepted. Class 60 is manubo na ha. 60 is already manubo. Okay, so 80 to 120 for that. In this case, class, manubo mo CBG. Okay, that's why class your patient would be maluya, dali makapon. Because class of the decrease of the glucocorticoids. Now, salt. Manubo ang salt class. And because ang pagnubo sang quote-unquote salt naton, nagnubo man si sodium. Kay nagnubo si sodium, guys, ano matabo kay potassium? Increase. Okay? Potassium class would increase. And because class potassium would increase, fatigue students, weakness would also happen. In addition, there will be anorexia, nausea, vomiting. What do you think, class, will happen to the weight? Weight gain or weight loss? In this case, students, you would have weight loss. Okay? Weight loss. Na, that's why kung na-notice nyo, hindi nyo siya kinanlan sa ulohon. No? Ay, kumadugduman mo, ay nag-decrease ang salt, ma-decrease ang sodium and water. And because of that, your patient's weight would be lost. Okay? BP. BP class, kinagdamay ang fluid sa lawas, what would happen? Increase or decrease? Your BP would be decreased. Very good. And for that, students, your patient will also be at risk for orthostatic hypotension. Dumduman lang again kung orthostatic hypotension, dapat ang pasyente nyo, class, hinay-hinay lang mag-change position. Your patient, class, would also be at risk for lightheadedness and even your dizziness for that matter. Pulse. Okay? Class, for the pulse, okay, ano ga katabo? Ang patient nyo, class, pulse. Okay? What happens, class, for the pulse? Dehydrated pasyente natin. Ano pwede matabo sa pulse natin? Okay? Diminished siya, but it's weak. But what's its rate? Is it dasig or mahina? Class, recall your shock. What would happen? Okay, class, initially, it is rapid and weak. Class, initially, when you're dealing with shock, class, initially, it's rapid. The pulse is rapid. But then, class, it's weak. Okay, that's for your pulse. Class, take note. Class, nga nagarapid ang pulse. What's the reason nga nagarapid siya? Very good. The body is just trying to compensate. And not for long. No? And not for long, class, the body will fail on the compensation. Okay? That's why initially, gambal kita tinaga nga initially, increased ang pulso. It's increased in rate, but it's weak. However, class, that compensation would not last. Okay? Now, what else? Ano pa nadula di sa akon? That's it. Now, sex. Class, anong pwede matabo sa sex? Characteristics ng pasyente naton? Class, menstrual changes, irregular ang menstruation sa aton pasyente. And then other than that, class, your patient may have impotence. Okay. Your patient, class, may have impotence. Other changes. Class, isa pagid kaga change no, sa aton pasyente is your hyperpigmentation. Your patient, class, would usually have hyperpigmentation. Now, paano kita, class, nag-hyperpigmentation? Class, with the decrease of the adrenal hormones, okay, nag-decrease, class, ang adrenal hormones sa Addisons, di ba? Ano, class, na gland ang matrigger? What gland would be triggered? Pag ma-detect sa bloodstream, oops, no, akon adrenal hormones. Sino nga gland, class, ang mag-work? Sino nga gland ang mag-push? Before the melanin, before mo na the concept of the melanin. Okay, very good, class. Your pituitary. Class, if the adrenal hormones are decreased, pituitary would sense it. No, pituitary would sense it. And then, class, there will be increase of your pituitary gland action. There will be an increased, class, of your pituitary gland function. And, class, part sa hormones na gina-excrete sa imo nga pituitary gland is your MSH. Okay, MSH. M stands for melanocyte. And then, class, your melanocyte will be connected na, class. Bukadastig niya mag-type sang isa. That would be, class, connected already to your melanin. Okay, that's why, class, your patient with Addison's disease would have hyperpigmentation. Okay, they would have hyperpigmentation. Okay? Now, ano plano tani sa ila? Since steroids are decreased, our plan is to give steroids. Okay, we need to give our patient steroids. Look at that, class. You have your hydrocortisone, which could be PO or IV. Class, diri sa aton setting, ang nakita ko lang yung common na hydrocortisone na nagamit is IV. No? Pag oral, class, na pag oral, class, na steroids, usually give your prednisone. Okay, prednisone. Then you also have, class, your glucocorticoid replacement. Then, class, for your mineralocorticoid replacement, I mean, Florinef is one of the drug of choice. And then, class, take note, liberal salt intake. Class, magambal kita nga liberal salt intake, meaning okay lang ya, class, kay patient, pakanon natin salty food. But it does not mean nga madugang kita ya sang asin. It does not mean nga madugang kita sang asin. This is usually, class, playing at 5 to 8 grams. No? Usually class 5 to 8 grams per day. 5 to 8 grams na siya class per day. Now, base bala magambal, kamuti sir madugang 5 grams of salt? No ha? You need to consider that some of the food products that your patient are eating could already contain salt. Okay? Now, during steroid therapy, damdaman nyo, anong side effects ng steroids? One effect is that it decreases your immune function. It decreases your immune function. And for that reason, guys, hindi mo sila pagpanapit sa may mga infection. Okay? Bisan sipon lang na class or flu, they might have severe pneumonia secondary to flu. Okay? How much more now in the time of COVID? Now, steroids class, anong effect sa sodium? Kung sige na-take ko sang steroids, ano na matabo sa sodium levels ko? Ma-increase or ma-decrease? Okay? Ma-increase na siya class. Kag ang problema ta naman kay tita naton potassium, ma-decrease. Okay? Ma-decrease naman niya si potassium. Okay, take note of that. Kung ma-notice yung class to, ginabaliskad-baliskad na lang halin kang gina. Then the next concept is that you have class your peptic ulcer disease. So your steroids could cause your peptic ulcer disease. For that reason, guys, your steroids kasi could also alter the gastric lining. No? Okay, it could also alter the gastric lining. So class for your peptic ulcer disease risk, ano brahon natin students, when is the best time to give your steroids? Would it be best given before meals, after meals? Okay, given with food class, best to be given after meals. Hatag natin siya after meals. And then class, you can administer it also with milk. And then ara na naman ang education, do not stop abruptly because of the risk for Addisonian crisis. Okay, do not stop abruptly because of the risk class of Addisonian crisis. And then class, there is what we refer to as psychologic letdown, meaning class nag-decrease ang function niya pag stop abruptly. And then class, steroids, caution also in diabetes. Kaya remember, kung naghahatag kita steroids, students, gina-improve naton ang 3S's, gina-improve ta ang sugar, ginapataas naton class ang sugar, di kung idugang ko na siya class sa pasyente nga diabetes, I am exaggerating the signs and symptoms of diabetes. I'm not actually helping the patient, but I'm actually adding to the signs and symptoms of diabetes. Okay? Complications, complications. Addisonian crisis. Okay? Pwede siya magka-Addisonian crisis. Now, class, Addisonian crisis, anong pwede matabo? Okay? So, class, it's acute adrenal crisis. It could be exposure to cold. It could be infection. It could be overexertion. It could be, class, emotional distress. Kung tanawon nyo ini class ng mga situations na ginbutang ko, these are situations, students, that would require increased steroids in our body. Look at that. Kung ma-stress kita, class, gataas actually steroids sa lawas ta. Kung ma-expose kita, class, sa cold, cold is also a stress to our body. Our adrenal would try to increase our basal metabolic rate by releasing these steroids. Okay? Overexertion, class, i-connect na lang sa stress. Pagkatapos, infection is also a stress to our body. Now, class, kung may adrenal insufficiency na nga ng pasyente nyo, and then exposed to these conditions that would warrant the need for additional steroids, your patient class would have Addisonian crisis. Your patient's class would have Addisonian crisis. So ano class ang matabo? Ang signs and symptoms hindi na pag-memorize class, those are signs and symptoms of severe Addisonian crisis. Think class, it will be severe Addisonian crisis already. Okay, in that case, severe hypotension, rapid weak pulse, extreme weakness, rapid RR class, and then you also have your pallor. Okay, it's as if your patient is undergoing shock. As if your patient is undergoing shock. Now, usually class, di ba maghambal kitang hypovolemic shock. Ang usual na natin guys na management, mahambal ginada yung plain NSS, no? Mahambal na yung plain NSS. Kung manotice nyo guys, subong may arat tayo D5 NSS. Kaya kung madumduman nyo class, your patient's glucose is also affected. Your patient's glucose is also affected. And for that reason, students, you will be giving your D5 NSS. It contains dextrose, no? And then you have your saline solution. Then class steroid IV is given to replace class your steroids. Then class you also have your vasopressors. Class vasopressors, remember this would improve your BP. This would also class improve your cardiac output. Okay? Class nakabutang diri titrate. Titrate. Class, what do I mean by titrate? No? Magambal ta na class. For example, the doctor would have an order for titration. Oftentimes, let me think. Okay, norepinephrine. Class mahambal na class norepinephrine. The common brand name class of your norepinephrine is Levofed, no? Mambala din ng doctor nga a certain milligram i-mix na namon class sa B5 water, tapos mahambal na siya at 5 microdrops per minute. Okay, 5 microdrops per minute. Tapos mahambal na siya class, then titrate by increments of 5 every 30 minutes to maintain a BP of 140/90. Ano namin sina class? For example, it's my first time to start Levofed, ha? Subong abi, right now it's 4 p.m. Ang BP class ng pasyente naton 80/60. Hambal si doc start na Levofed. So class 5 microdrops per minute. After 30 minutes class, i-check ko na BP sang pasyente. After 30 minutes students, pag-check ko sang BP sa pasyente, 80/60 gyapon, increase ko na siya class by 5. Okay, ubrahon ko na siya nga 10 microdrops per minute. Let's say for example, 5 p.m., nag-check ko sang BP, nag-90/60. Wala ko man gyapon na attain ng 140/90. So increase ko naman na siya class by another 5. Okay? That's what you meant by titration. Let's say for example, tag 30 minutes kinang monitoring mo class. Pagka 8 p.m., ang pasyente nato nag 150/100. Mambal ka, oops, taas na. Okay? Butang tabi class 30 microdrops ka na din, no? Kung nag 150 na siya class over 100, decrease mo naman by 5. 25 microdrops per minute. Okay, that's what you meant class by titration. You are adjusting the dose of the medication depending on the parameters being set. In this case, guys, your parameters is the blood pressure of your patient. Okay? Commonly class ginaobra sa intensive care unit. Now, since we've mentioned about titration, what do you think, students, is the equipment that could help us to accurately regulate this one? What equipment could help us to accurately regulate class the flow of your BP? Sige na, ano class ang tawag nyo sa equipment class nga maka-regulate sang aton IV accurately? Hindi nyo class pagkopyahan na yung isa-isa, gina-demonstrate ko lang na yan sa inyo as an example. Very good, ha? Infusion pump. Very good. That will be class your infusion pump. So, mangkoton ka mo, Addisonian crisis. Anong equipment ka dapat bantayan mo pagid sa ICU? Dugang na naklas sa istorya, infusion pump. Okay, you need to add your infusion pump. Okay, that's one example for titration. Now, class, you have your D50. Class, magambala ko D50. Class D50, usually we give 50 ml no, of D50. Class, gahatag kita D50 for hypoglycemia. Class, your D50 is given IV. It's given IVTT. Class, malapuyot ni siya nga bulong ang D50, ha? Class, and you're given it IV push, so meaning you will be preparing a 50 ml syringe. Kung wala kaya 50 ml syringe sa ER mo, pangita ka da sang 30 ml syringe, okay? But don't use the 5 ml syringe kaya iyawan mo ka refill. Okay, so class, it's 50 ml. I mentioned it's a bit malapuyot, so class, it's best for you to use your large bore needle. Ha? Class, use your large bore needle. Dapat class dako ang needle mo para samtang nag-push ka students, hindi pagtubuan muscles ang imong tudlo. Class kay katiga gid niya i-push. Okay? So class, ang syringe nga na i-attach mo pa man na sa, what do you call this? You attach class the syringe to the Y port of your IV. Okay, dali lang. Para hindi kita mag-imagination. Ka-duty ka mo hospital. Wala, no? Okay, so class, sige. So kung class may 50 ml syringe ka to, ang Y port tas ang inyong IV, Mangita kita class ang macro set. Okay. Are class ang macro set. Wala ka na ti whiteboard. Ikis. Okay, let's look for another. Wise men say. Ay, di rin si Sir nyo kakilala ka whiteboard. Oh. Ari na lang class. Oh. Sa Shopee. Si Shopee na lang solusyon sa talang nga butang tangang problema. Wait lang. Sa Shopee na naman tayo napunta. Class, kita nyo na ang yellow nga na. Oh, muna class ang whiteboard niya. Okay, aring yung tabunan, class ang gahulag-hulag. Ara class whiteboard natin. Ha? So class, what do we do? Dira natin gina-inject ang gin-withdraw natin sa syringe. But class, administering D50 would usually take you 15 to 30 minutes. So dapat kabalo ka mo nga dako nga needle class gamiton nyo para nga ang pasyente nyo hindi ka mo madugayan withdraw halin sa bayan, kag it will not be very slow for you to administer the medication. Okay, so that's for your D50. Okay, that's it for your Addison's disease. Nalingaw man tas ang Addison's. Now let's proceed to your Cushing. Kung gaginaklas sa Cushing, sa Addison, problema tanubo si salt, sex, and sugar. Your problem, students, in Cushing is that they will be high. Okay, they will be high. They will be high in salt, they will be high in sex, they will be high in sugar. Hindi class nga high in sex na mag-high ang libido, but there will be an increase of secondary sex characteristics. Okay? Now class, everything is high in Cushing, except class for your potassium. Your potassium would be decreased. Class, your calcium would also be decreased. And then class, for that reason, your pulse rate will also be affected. So pulse rate would also be decreased. Isa-isa honta, ha? Class, sugar, nagtaas. So there is hyperglycemia. Class, kung may hyperglycemia, kung ano next kung problema? Diabetes. Pag may diabetes ko, class, what happens to the wound healing of my patient? Is it normal, fast, or slow? Normal, fast, or slow. So class, isa ka problema mo sa pasyente class na may Cushing syndrome is that there will be slow wound healing. Okay? Mahinay ang wound healing. Now class, sodium would be increased. And because sodium is increased, ari na class, si potassium naton nag-decrease. Class, there will be fluid retention. There would be edema. And then class, your BP, hypertension class would happen. Okay, now, sex, no? Ang sex naman class, nag-exaggerate. So, ano pwede matabo? Boys class would have, naghulag. Students, your boys would have gynecomastia. Kaya diba exaggeration of secondary sex characteristics. Kay class, madagaling nakasulat sa notes nyo, you can have your clitoral hypertrophy. And then for female students, there may also be amenorrhea. There may also be amenorrhea. Mambalti, sir, nag-exaggerate, dapat madamo man iya menstruation. Students, take note nga, if you would look at the process of menstruation, once there is an imbalance between your hormones, your menstruation would not ensue. Okay, for that reason, class, amenorrhea. Now, stretch marks would be there, and the stretch marks would have a tendency to be striated, purplish striate class. Fat pads, amo na class kang ginambal nga, ano ganito? Buffalo humps. Dire na class masulod ang buffalo humps mo kag ang moon face mo. Now, these patients would also have a tendency to be irritable, emotional lability, insomnia, pwede class na magka-risk for infection. Kay tandaan na, sobra naman class na steroids. So, risk also for infection. Ari naman kang gina na mention ta, pag magsobra tong glucocorticoid, osteoporosis. Tapos students, you add this, they will get increased risk for bleeding, petechiae, and ecchymosis. Increased risk for bleeding, petechiae, and ecchymosis. Okay? Now, for that reason, what do we do? You need to protect your patient from trauma. Okay? Ari class, kung sa psych nyo, balikan nyo si psych, may irritability, emotional lability, insomnia, ano class sobrahon natin kay patient? Plus, you need to increase your, or allow class to for verbalization of feelings. Okay? I hope maka-duty pa ka mo psych, no? Namin na taning experience class na makatanaw ka mo sang psych ng patient kag makahandle actual. So, medications class, these are all medications that can suppress your adrenal functions, no? And then you can have chemotherapy, irradiation, and then surgery. Kay class, isa pagigili sa common man nga reason sang Cushing is that the presence of tumor or mass. Okay, presence of tumor organs. Now, let's go to your Conn's disease. Class, your Conn's disease, no, your Conn's syndrome is usually caused by an adenoma. It's usually caused by an adenoma. But if you would look at the problem, students, the problem is in your mineralocorticoid. Okay, the main problem, class, is in your mineralocorticoid. Your Conn's syndrome is characterized by a problem in salt, but the sugar and sex is not affected. That's why kung tulokon yung class of blanco, wala di siya manifestation, wala man di siya manifestation. Ang aton manifestation is related to the excess of your aldosterone. So sodium, amo man nagyapon istorya, fatigue, muscle weakness, BP mataas. Now class, because of this, your patient may have polydipsia. Isa ni class ka sign niya, ang pasyente class the polydipsia. And then class the patient would also have polyuria. Kay class polydipsia, polyuria, and then class your patient would have low urine specific gravity. Okay, these are among of the additional signs and symptoms that your patient would experience. Okay, class polydipsia, polyuria, and low urine specific gravity. Now, let's go to the management. Class, you give your spironolactone. Okay, take note, class, when I talk spironolactone, is it potassium sparing or potassium wasting? Okay, potassium sparing. Spironolactone, class, aldactone is the common brand. It's considered to be a potassium sparing diuretic. Being a potassium-sparing diuretic, students, it increases your potassium levels. Kaya ang problema, tagani, di ba nagdubo ang potassium? You also, class, do your antihypertensives, and then, class, you do your adrenalectomy. So, class, adrenalectomy, kung bilateral siya, class, nga adrenalectomy, the tendency is that your patient, okay, kung bilateral siya, guys, your patient, guys, would need steroid therapy for a lifetime. Okay, it would need class steroid therapy, class, for a lifetime. Then, class, if only one adrenal gland has been removed, class, your patient might need steroid therapy for 2 to 3 years. Okay, steroid therapy, class, for 2 years. Okay, nga class din tagaan 2 years to give the other adrenal gland, class, an opportunity to adjust. Okay, opportunity to adjust. Now, class, after adrenalectomy, watch out, class, for the effects of catecholamine drop. Kasi class, gin-remove ta ato yung adrenal gland, the tendency is that, oops, wala na epinephrine, wala na, class, norepinephrine. Okay, so class, that's what you refer to as catecholamine drop. Okay, so cardiovascular collapse would be one problem. Okay, that's why, class, you need to have substitutes for that also. Okay, that's it, class, for your adrenal gland problems. Okay lang, class? Are you learning something from our discussion? Okay, sige. Kaya pa until 5? Wala na, may gasabat. No? Okay, class, so pancreas. Your pancreas, class, both has endocrine and exocrine function. That's why it's referred to as both an endocrine gland and exocrine gland. If I'll be talking about the exocrine function of the pancreas, what are the 2 hormones that your pancreas is excreting, class, being an exocrine gland? That would be your okay, exocrine, class, that would be your amylase and your lipase. Yes, amylase and lipase. Okay, today we are more interested of its function being an endocrine gland. So, class, you have three hormones that are produced by your endocrine pancreas, and these are your glucagon, your insulin, and your somatostatins. Okay, now let's talk about your alpha cells. So, guys, nakabutang dira ha, alpha cells, meaning, students, the glucagon is originating from the alpha cells. And then the trigger for that is that it is released when there is low blood sugar. So, class, what happens? Once mag-decrease ang blood sugar sa aton nga lawas, okay, your glucagon, class, would be released, and that the effect of your glucagon is to increase the blood sugar levels. Okay, it would increase the blood sugar levels. Now, it increases also, class, your glycogenolysis. Now, when I say glycogenolysis, what do I mean by that, class? Lysis, is it build up or break down? Okay, break down. And this one is breakdown of glycogen to, it's breakdown of glycogen to become glucose. Very good. Class, in this case, you break down glycogen to become glucose. Okay, that's how your glycogenolysis would be working. Now, let's talk about your gluconeogenesis. So glycogen to glucose. Now, class, your gluconeogenesis is done by your liver. Kay class, tanawa ngalan, gluconeogenesis, meaning it would still be formation of glucose. However, class, in this case, no, it's coming from non-carbohydrate substances. Okay, it's coming from non-carbohydrate substances. Give me a non-carbohydrate substance that could be converted to glucose, class, by our liver. Very good. Amino acid. Feeling ko bala, class, daw na unahan. Amino acid, class. Amino acid could actually be converted by your liver to become glucose. Okay? Kung padakuon tapagid, class, that would be coming from your protein. So class, in the case of gluconeogenesis, it is the use of your protein. It's basically your amino acid to be a source of glucose. Now, so again, overall effects ng glucagon is to increase the blood glucose levels. Let's talk about insulin. Insulin, so kiginisang tanan. That would be, class, produced by your beta cells. No? Produced by your beta cells. So transport and metabolize carbohydrates for energy. Now, class, you have glycogenesis. So in this case, students, it increases glycogenesis. Magambala ko, class, glycogenesis, it would be build up. Diba? It would be formation or build up. So, excuse me. Class, that would be formation of glycogen. Class, what's the purpose? Nga class, nga ang glucose, ginaubra nga glycogen. What's the purpose of our body? Why is your glucose converted to glycogen? Okay, very good. For the purpose of storage. So in this case, guys, ginapanubo. Diba? We know that insulin would decrease blood glucose levels. So class, glucose is converted to glycogen for the purpose of storage. For the purpose of storage. It also, class, decreases your glycogenolysis. It decreases, class, your glycogenolysis. In other words, it decreases the breakdown. Hindi niya, class, gusto nga ang imo nga glycogen mahimo nga glucose. Pagkatapos, it would also signal the liver to decrease the glucose production. It would signal the liver to decrease glucose production. It would enhance, class, the storage of your dietary fat, and then it would accelerate the transport of amino acids into cells. So take note, ang amino acids, class, kinapakadtoya sa cells rather than to make them glucose. And then, class, it also decreases your lipolysis. It decreases your lipolysis. Tandaan nyo ni class na ang insulin would have a function on the decrease of lipolysis. In other words, gina-decrease ang pag-breakdown sang aton nga fats. Kaya nga, class, once mag-breakdown ang fats, anong pwede matabo? What is the byproduct of fat breakdown? What is the byproduct, class, of fat breakdown? Good, ketones. Okay? Kasi mahambal, kung kabi ko mahambal pa kamong fatty acids. Sige, fatty acids, class, mag-breakdown, mahimo siya ketones, leading to your complication, ketoacidosis. Okay, ketoacidosis. Now, butang, class, sa mga utok naton, ang insulin naga-decrease ang lipolysis. Ang insulin, class, naga-decrease ang lipolysis. For that reason, students, it could stop ketone bodies from forming. It could stop ketone bodies from forming. Now, may duha kita, class, ka common complications ang diabetes. Mayara kita, class, DKA, kag hyperosmolar, non-ketotic coma. Okay, class, you have your hyperglycemic, hyperosmolar, non-ketotic coma. Class, sa duha ka klase ka diabetes, DM1 kag DM2, sino ang mas prone sa DKA? Between DM1 and DM2, who would be more prone sa DKA? Class, kung gamiton ko ni ang knowledge ko about insulin nga naga-prevent sang lipolysis, you will be able to deduce that DM1 is prone to DKA. Nga, class, ano ang insulin sa DM1? Naggamay lang or zero insulin gidya? Very good. Zero insulin kagidya, class. No insulin kagidya sa DM1. For that reason, your patient will be at risk for DKA. Class, ang DM2 nato niya, DM2 would have some insulin, and that some insulin could still stop lipolysis. This some insulin class could still stop lipolysis. And for that reason, students, your patient will be able to stop ketone bodies from performing. Okay, so tandaan na ha, DM1, DKA. Now, you have your somatostatin. Medyo complex na gani ang function ni somatostatin. It would inhibit the release of both insulin and glucagon. Siling nila, it would be working for the negative feedback mechanism daw. So one of the action is to delay the absorption of the nutrients from the GI tract para kuno nga si insulin hindi magtamaan ng action. And also, class, it would prolong the duration of your intestinal absorption after a meal. Now, let's talk about your diabetes mellitus. Class, your diabetes mellitus is a metabolic disorder, glucose intolerance, caused by an imbalance between your insulin supply and insulin demand. The causes, students, are enumerated there. Okay? Class, duha lang man na ang major cause yagid nga balikan. One is heredity, and then the other one, class, is lifestyle. Okay? Other one is lifestyle. In your lifestyle class, dyan papasok si diet, and dyan papasok si activity. Class, both heredity and lifestyle would have a role in diabetes mellitus. But between the two types, sino ang mas greatly affected sa heredity? Will it be your type 1 or your type 2? Okay, very good class ha. Heredity, may major role siya kay type 1. Okay, kung manotice nyo class, DM type 1, madakpan natin sa kabataan. Okay, now imagine 10 years old having diabetes. Kailangan mambal ka sa grabe, ginaya kaon niya. No, less likely. Class, that's why you refer to type 1 as juvenile diabetes. Okay, more siya sa heredity. Parents may diabetes. Pag salo iya sang genes, higher risk already for diabetes. Now, si type 2 ya class, although may heredity man nga component, pero class, it's more of lifestyle, no? Kaon ka sweets, wala halos activities, leading class to your type 2 diabetes mellitus. Okay, type 2 diabetes mellitus. But class, both heredity and lifestyle would have a function or would have a contribution to your DM. Okay? So possible autoimmune, naguba ang pancreas. Possible class ng infection at the early age, guba ang pancreas. Genetics, destruction of pancreatic cells, excessive blood glucose class related to diet, obesity, stress. Kung i-connect nato ng stress, kung ano katabo, ano gani class ang ga-increase class sa stress. Once there is stress, there would be an increase of your glucocorticoids. Okay, class, nag-increase ang atong glucocorticoids. Okay, may nagsulat sang 3 S's. Yes, it goes back to your 3 S's. And then class, even your stress could actually also increase class your catecholamines. Ha? Ga-increase man na siya sang catecholamines. So, gina-trigger yagid si adrenal gland. Now, pregnancy. What particular hormone in pregnancy, students? What particular hormone in pregnancy could possibly affect, no, leading towards diabetes? Di ba, mamangkot sila, may 3 types of diabetes. Ang next one ang type ni dugang gestational diabetes mellitus. Okay, progesterone. I can see a lot of people talking about progesterone. Are you thinking it's the hormone of pregnancy? What particular hormone class, no, produced in pregnancy can antagonize, no, can antagonize your insulin? Okay, a hormone that can antagonize your insulin. What do you call that hormone that can antagonize your insulin? Starts with letter H. May masulat HCG. Oh. Okay, very good class on your human placental lactogen. Okay, students, it is your HPL, your human placental lactogen. Okay, human placental lactogen. I've read somewhere about progesterone, but I'm informed by textbooks that human placental lactogen would have a higher weight class on antagonizing insulin. Okay, so human placental lactogen. Now, class, you have the formula here for ideal body weight, just for us to be reminded some risk factor. If your patient is consistently above the ideal body weight class, your patient would be at risk for diabetes mellitus. Okay. Now, class, this is the classification of the BMI. I've derived this from a medicine book. Why did I have this on you? Why did I have this shared for you, class? Because this has a consideration on the Asian classification. Okay, this has a consideration for the Asian classification. If you would look at this, kung sundon ka ang WHO class, 25 pa yan kinakonsider nga overweight. Class in the Asian classification, 23.0 could already be considered overweight. No, sa Asian classification. Okay? So, just for you to be reminded, it's also a risk factor. Now, let's have the comparison. Ha? So, the comparison class of your two diabetises. Okay? Wala class ang diabetises, saba sa ilog-ilogon nyo man. So, class type 1 diabetes is IDDM. You have your juvenile diabetes mellitus. So, commonly class at the age of younger than 30. Okay? Your problem here is that beta cells are destroyed. Your beta cells class are destroyed. There's absolute deficiency of insulin. Absolute deficiency of insulin. Class, your patient would appear to be very thin. Nga class, niwang sila because class, bisan ano nila kakaon, wala gidya sang insulin nga makabulig class that this food intake of theirs would be processed and metabolized by the body. So their tendency is that gamay sila. And then one of the major risk complication, that they would have is DKA, your diabetic ketoacidosis. And that is, as explained earlier, that's because students of the absence of your insulin. Okay, that's because class of the absence of insulin. So management, para ganyan class ang dietary and lifestyle modifications, but keystone or cornerstone to its management students is insulin. Insulin. As the name would imply, insulin-dependent diabetes mellitus. Meaning class drama yan na can't live without insulin. That's what they need. Now, type 2, non-insulin dependent, maturity onset. Class, there is relative, take note the term is relative, not a complete absence of insulin, but a relative lack of insulin. Class, the insulin here is enough. The insulin is enough to stop lipolysis. Okay? But not enough students, not enough for your sugar metabolism, not enough for glucose metabolism. Okay? That's what happens in your type 2 diabetes. Tendency, tambo. Then class, your patient would have hyperglycemia, hyperosmolar, non-ketotic coma. O, tanawan nyo ng ngalan niya ha, hyperglycemia, tapos may ara pag hyperosmolar, tapos non-ketotic coma. Tandain nyo ngalan nga na, kaya ang iyaklas nga signs and symptoms, dira lang man nagyapon gabalik sa hyperglycemia, hyperosmolar, non-ketotic coma. Okay? Diet and lifestyle modifications could be done, and your first line of therapy, students, is OHA. Ano ganing OHA, guys? Oral, ito ginabantayan ng hypoglycemic agents. Okay, so class, you have your oral hypoglycemic agents. Okay? Then class, you have your insulin as the second line. Now class, pwede na yang nga OHA updon kay insulin. Or during acute stages or acute illness, gahatag kita class ang insulin. Okay? Let's say for example, operahan si diabetes. Okay, for example, ma-undergo siya class operation. We don't usually use operation. Mag-undergo siya class surgery, or hindi ganit class may masakit siya, nga nag-infection siya, kag na-admit siya, usually naghahatag kita insulin because it would be easier to control the levels of insulin. Okay? If your patient class would have diabetes, kag na-admit siya. Okay? Please take note of that. Now, let's go towards the pathophysiology of your diabetes mellitus. Class, there's a lot of way for you to do your pathophysiology. This one class, try to keep it to the minimum. So let's have it. One problem is insufficient insulin. Okay, insufficient insulin. Now, dahil kulang class ang insulin, there will be an inability of your body cells. Okay, in a while. Okay, class, we will continue the pathophysiology of diabetes along as its assessment and management on the next meeting.